Hello, everyone, and welcome to today's MinMD Real Talk webinar, Vacuum Erection Device Online Clinic. My name is Austin Hunt, and I'll be your moderator for this event. I work on the marketing team here at MinMD, and we're excited that you're joining us today. Also joining the call from MinMD today is Karen Bono. Karen will be joining us to help answer any questions relating to MinMD during the Q&A session. Before we get started, we have a short disclaimer that we need to review. The health and medical information provided during this webinar, as well as the questions and responses from the webinar provider, are solely for informational purposes. This content is not intended to take the place of advice or treatment from health professionals. Nothing presented in this webinar is intended to be used for medical evaluation, diagnosis, or treatment. It is not intended to substitute for your relationships with your own healthcare and pharmaceutical providers. Always seek the advice of your healthcare provider before beginning any new treatment, or if you have questions regarding a medical condition. All right, with that being noted, I'm pleased to introduce today's presenter, Dr. Andrew McCullough. Dr. McCullough is a board-certified urologist with over 30 years of experience in male sexual and reproductive health. Dr. McCullough specializes in erectile dysfunction, premature ejaculation, low T, BPH, Peyronie's disease, infertility, and the prevention of post-prostatectomy ED, and he's located in Burlington, Mass. Today he's going to cover VED device assembly, penile reconditioning, VED use for sexual activity, penile rehabilitation for post-prostate treatment, and then hold a live Q&A to close out the webinar. So without any further ado, let's kick things off by asking our audience a few poll questions. So I will go ahead and launch the poll questions now. First question here, how long have you been experiencing ED? All right, we just closed the poll. We'll share the results now. So it looks like majority have 3+ years of experiencing ED, with the next being 1 to 2 years. So we'll move on to our next poll question now. Have you attempted to use a VED before, yes or no? All right, just closed it. We'll share the results now. So it looks like majority have tried to use a VED before. All right, and we'll move on to the last question here. Have you attended one of our previous MinMD Real Talk webinars before? Yes or no? So we hold webinars throughout the year on various topics. We're up to about 5 now, ranging from injection therapy, VEDs, all the way to low testosterone, prostate cancer. All right, we've got a even split here, 50-50. So thank you for joining us again, those of you who have, and welcome to those of you who have not. All right, so poll questions are now done. We'll kick things over to Dr. McCullough. The stage is yours.
Thank you all for attending this seminar on the vacuum erection device. I've been doing this for a lot of years and have used the vacuum device for my patients for over 30 years. So let's first talk about the erection process, because I think it's important to understand what's going on with the penis. And the bottom line is, it's all about hydraulics. So when you have to be aroused, and that's the brain sends a message down the nerves to the penis. The penis then, which is limp, in a constant state of contraction. And that's an important concept, because normally you think of a contracted muscle as a firm muscle. But in the penis, the limp penis is actually contracted. The muscles in the penis have to relax, and the muscles in the arteries have to relax for the blood to fill the penis. So then the blood fills the penis, the full penis then chokes off the drainage, and the penis becomes erect. It's the blockage of the veins that's responsible for the erection. Now, of course, the orgasm happens and the whole process reverses itself. So anything that affects the brain, the nerves, the arteries, the muscles, or the veins can negatively impact erections. So number one is age, and the penis was designed for procreation. So evolution has planned obsolescence for this organ. there's really no need in terms of our species for a penis after our partners can no longer procreate. So at age 40, you were at the back of the cave, no teeth, no food, and no women. And many women died during childbirth in those ages. So stress, anxiety, depression, marital strife, children acting badly, all can affect the ability to have an erection. And that's the central nervous system. Diabetes, it can affect the pipes, the vessels, the muscles, the nerves, the veins. Hypertension can affect the pipes and the pumping station, the heart, if you have heart failure. High cholesterol can affect the pipes. Medications, everything that you put in your mouth can affect the penis. So sometimes you don't realize it until you say, wait a minute, I just started medication X and now I can't have erections. Heart disease, that's the pumping station for the penis. And then you have the surgery, prostate cancer, bladder cancer, colon resection, disc disease, and vascular surgery. Neurologic disease, hormones, your hormones can be low, and that can affect your erections. And finally, the bad habits, alcohol, smoking, and opioids. Treatments, well, psychotherapy, Sigmund Freud thought everything was related to the brain. And that's the way it was until the 60s when we realized that there's more to it than the brain. We can improve overall health, medications, the Viagras, the hormones, intraurethral pellets, penile shots, any combination of the above. And of course, there's the penile prosthesis, but don't forget the vacuum device. Well, it's been around a long time. And this is an article, 1912, from a German guy showing the penis pump. This is a book that I ran into in 1937 where they talked about using the penis pump. And you can see the vacuum pump and cup, both the penis and scrotum are enclosed in the cup with a partial vacuum is produced, which is maintained for 10 minutes to a half an hour. That's a long time. So the FDA has approved in 1982 the vacuum device. So the vacuum device that you get from reputable companies have met FDA guidelines in terms of the design feature, the quick release, the size, the amount of vacuum that is delivered, the smooth surface of the tube. In battery operated devices, they should have adequate electrical isolation. These may seem like logical things, but you know, the pump that you get for 20 bucks on Amazon.com may not meet these criteria. So the applications of the vacuum device, all causes. Restoration for erectile dysfunction. Restoration of penile size, and we'll talk about that in a little bit. Erectile dysfunction when other therapies fail, or in combination with them, whether it's injections or whether it's Cialis or Viagra or any of the pills, you can use them in combination. You can use it for penile rehabilitation after radical prostatectomy. We'll talk about that in a little bit. We can straighten the penis in Peyronie disease, and we can increase the girth and the length of the penis after a penile implant is put in. So here we go to the vacuum device. What is a vacuum erection device? Well, it's an FDA-approved Class 2 medical device, and basically it works. It's a hollow plastic tube placed over the penis. It's either manual or battery operated. And what happens is that this band here is slipped over the base of the tip of the penis, of the tube. The penis is placed in the device. Erection is created with vacuum. And again, remember the penis is contracted. So we're basically causing a relaxation of that muscle in the penis. And then after the penis is erect, the band is placed. How effective is it? It's effective in only in over 90% of men. There is a right fit. VEDs, much like orthopedic devices, require fitting and adjustment. So there are components that can be tailored to the patient, but it's just like any other device that requires fitting: glasses, knee braces, crutches, or even orthotic shoes. So this is the vacuum device. This is the Owen Mumford. which are sponsors for this evening's talk. And basically, you have the pump head. This is the manual device, the manual pump. You have the plastic tube. You have the transfer sleeve. So what you do when you have put the ring, you want to basically slide it on this conical device which fits on there, and then it sits right there so that you can slip it off when the penis is erect. And of course, you have a sizing guide, and you have different rings to use. And this is an example of one of the rings, and you can see you can stretch the thing and slide it over the cone. There is a learning curve, just like everything else, and it sure does help to have a cooperative partner, because this is a process, and it is in a sense a sex toy. It allows you to be sexually active. So the keys to mastering the device is a desire to learn a new skill with a supportive partner, willingness to follow instructions and experiment with simple components, commitment to learn how to use the device before attempting sexual intercourse. It's like anything else. And I always tell my patients, take it on a few test drives before you go on the open road. And focus on the goal. Consistently creating your fullest natural erection in 1 to 3 minutes. I mean, you think about the pills, oh, we got to wait 20 minutes. Well, this is 1 to 3 minutes. So in terms of spontaneity, yeah, you have to go get the device out of your nightstand, but 1 to 3 minutes is nothing compared to 15 to 20. You have to understand the amount of time without experiencing the natural erection is a factor in how much time reconditioning the blood vessels in the penis will take. So we'll talk about penile reconditioning in a little bit. Okay, so now we're going to have a little video, if I can.
Before you start, familiarize yourself with the contents provided in your Rapport Classic Vacuum Therapy device system. You will find the constriction ring sizing guide at the back of your instruction for use booklet. To use your Rapport Classic device, you will first need to determine the correct constriction ring size. You have received 5 constriction rings with your Rapport Classic device. Select a slot which fits firmly around the base of your flaccid, non-erect penis. Try the largest size first. Each slot has a ring size marked above it, which corresponds to the ring you require. The constriction ring is placed at the base of your penis next to your body, and choosing the correct ring size is important to maintain the erection for the necessary period. Once you have selected the right ring size, you're ready to begin. There are 2 transfer sleeves provided with your Rapport Classic system. Depending on the size of your penis, you should choose which of the 2 is likely to be the most suitable. Remember, your erect penis will need to be withdrawn through the transfer sleeve. One of the transfer sleeves included with your Rapport Classic system is already attached to the penile tube. If this is the correct size transfer sleeve for you, you can leave it in place. If not, remove it and fit the remaining transfer sleeve. Fit the loading cone onto the transfer sleeve and apply a little lubricating jelly, included with your system, on top of the cone. Holding the constriction ring by the outer handles, simply stretch and pull the ring down the loading cone until it slips onto the transfer sleeve. Make sure the constriction ring is located on the flat groove at the center of the transfer sleeve. The constriction ring is now mounted and ready for use. Before continuing, make sure you use the lubricating jelly to lubricate the end of the transfer sleeve. Also, lightly lubricate the penis to prevent it from sticking to the inside of the penile tube during insertion, or while using the pump. The pump head has 2 small pegs on each side above the orange ring. These should be positioned into the 2 grooves on top of the penile tube. The 2 parts are then locked together with a twist, so that the 2 pegs slot down and locate at the lower end of the groove. If these two parts are locked together correctly, it will ensure the unit is sealed tight enough to create a vacuum inside the penile tube. To ensure a vacuum will be created, insert only your penis into the penile tube and apply slight pressure to the seal with the transfer sleeve against your body at the base of the penis. To ensure that a vacuum is created, it may be necessary to groom the hair at the base of the penis. Make sure the constriction ring on the transfer sleeve is in the correct position with the handles to the top and bottom. Continue pumping slowly to create the erection. If you feel any pain, stop pumping and press the release button to eliminate the vacuum. You can try again when you're ready. Pumping slowly is most beneficial. When the desired erection has been achieved, continue to hold the tube tightly against your body. Ease the constriction ring off the transfer sleeve and onto the base of your penis. Press the release button to lower the vacuum pressure and remove the penile tube. With the constriction ring in place, sexual intercourse can be accomplished. If a condom is to be worn, it should be put on as a last step. Please ensure that the lubricating jelly used with the system is compatible with your condom type. To remove the constriction ring after intercourse, simply grasp the outer handles to stretch the central ring. As the blood is released from the penis, it will decrease in size and the ring may be easily removed. Do not wear the constriction ring for more than 30 minutes at a time and allow a minimum of 60 minutes between uses. Please consult your instruction booklet for a comprehensive set of instructions, safety precautions, warnings, troubleshooting, and cleaning instructions.
Okay, penile reconditioning. What exactly is penile reconditioning? Well, everybody's heard the expression, if you don't use it, you lose it. And there is no more clear view of that or example of that than after a radical prostatectomy, where a man loses his ability to have erections. So this is an example, and if you can see, you probably can't see much, but these little arrows are pointing to the blood flow in the penis in the flaccid contracted state. This is the blood flow in the penis in the erect state. Well, when you have a radical prostatectomy or you have severe ED, your penis is always in this state. So your penis is not being nourished with arterial blood. This is all just venous blood and very little amount of it. This is an example from a study that I did where you can see the nocturnal erections, the nighttime erections that men have. Well, this is a 58-year-old man, and 1 month after surgery, he has zero erections. Remember what I said about the penis in the flaccid state being in a state of contraction. So that means that whether it's because of loss of hormones from having your hormones removed for prostate cancer, whether it's radiation therapy, whether it's a radical prostatectomy, whether it's a colon resection, anything that eliminates the nerve signals is going to result in a penis that is constantly in that contracted state. Now, to go from that contracted state to one which is a relaxed state to get the blood in there is a big deal. And that's why the Viagra pills don't work in that setting, because the nerves are shot. So how does it work? What do I tell my patients? Basically, I say, look, you have to recreate these erections. So every day you want to have an erection. Now, it doesn't have to be a long erection, but it has to be an erection that is substantial. And what I found is that just doing this 2 minutes each day without use of the constriction ring is enough to increase the blood flow in the penis. Best time is after a shower. Why? Because the body's warm. So for the guy after radical prostatectomy, this is as important as the Kegel exercises for continence. Show your penis some love. Don't just worry about your bladder. You got to use a vacuum device to recondition your penis. And the benefits are not always immediately apparent. But you can imagine, here you are, 18 months, the nerves have finally grown back, and the nerves are ready to talk to the muscles. Well, guess what? You haven't talked to me in 18 months, and you want me to be reactive? It doesn't happen. So it's really important to do this after the surgery. This is what I was explaining. Again, contracted penis, relaxed penis, contracted penis. So after each erection is created, you release the erection, and you repeat 10 to 15 times over 2 to 3 minutes. Why 2 to 3 minutes? Well, when I was way back when, I was trying to figure out what was the right formula for these patients. Was it 10 minutes? Was it 15 minutes? And then I said, well, what does every guy do twice a day? Well, he should brush his teeth twice a day for 2 to 3 minutes. So I said, well, let's see what does 2 to 3 minutes of the intermittent erection do? And it basically oxygenates the penis. So this is from the study that I published, showing that this is the thigh. So obviously the thigh is not affected, but the glans penis, the head of the penis in green, and the corpora are oxygenated immediately. And that lasts for up to 60 minutes. So that's the rationale for doing this after radical prostatectomy. What about Peyronie's disease? Yes, it works too. You can see the curves is improved by 17 degrees here. Now, if you have a 45-degree angulation and you improve by 17 degrees, that's a major win. And guess what? It didn't involve surgery. So the vacuum device can work for Peyronie's disease. Now, I want to do a little demonstration for you. And even if you've had Xiaflex, it works. So this is just a glove. And what I want to show you is that this is what the vacuum device is doing. It's creating a vacuum, and it's drawing the penis into, I don't know if you all can see that, it's drawing the penis into the tube, just like it's pulling in this glove. And that's the rationale for doing that. Now what about penile enlargement after penile implant? One of the major complaints about patients with penile implant is like, doc, what'd you do? My penis is shorter than it used to be. Now, it's like the fish that got away. A lot of guys don't realize that their penis has already shortened. But there is some degree of shortening that can occur because the body wants to react to a foreign object by basically sequestering it. And it forms a capsule around the implant. Now, if a guy is not sexually active more than once every week or once every 2 weeks, the body is basically closing in on that deflated implant. So when he activates his implant, it's not going to work, or it will work, but it's only going to go up to the capsule. So you have to constantly basically stretch the penis, even though you have an implant. And the slides that you see there are from a patient of mine who had a penile implant. And as a matter of fact, I just saw him today. And he basically used a vacuum device to increase the swelling around the implant. Now, why does this happen? And I thought long and hard about this, and I said, well, gee whiz, if you have basically an implant is like an inner tube in a tire. So if you have, you blow up the inner tube and it goes up to the size of the tire. But what happens if we stretch the tire? Guess what? The inner tube will basically swell to fit that tire. So that's the concept behind using this after a penile implant. So the best candidate for a VED is basically any man who wants to have sex. It's used to create and maintain erections for sexual intercourse. It's used for penile reconditioning to maintain penile health. And sometimes the pills work somewhat, but not just quite enough. And this can make the difference. Or the guy with venous leak who has, when he injects himself with Trimix or whatever, the medication to create an erection, and he stands up, he gets a full erection. But the minute he lies down, it goes away. So when he's standing up, he can then use a vacuum device to basically lock in the erection and then seal it with the constriction ring. Side effects, well, guess what? You're blocking the urethra, so you may not have some ejaculation, which, if you have had a radical prostatectomy and you leak urine when you're having a climax, that will eliminate that. So the side effect is not always a bad one. It can cause penile numbness if you tighten it too much, and some bruising or discomfort. I have had patients on Coumadin and Eliquis use the vacuum device as well, but you have to do it judiciously. And that's the thing about the vacuum device. If it's FDA approved, that means it can only create so much vacuum. Some of these lower quality vacuums, there's no regulation in terms of the amount of vacuum that can be created. So don't use the constriction ring for more than 30 minutes, and talk to your doctor about the Coumadin and Plavix issue. So in summary, the vacuum device works for all sorts of erectile dysfunction. It works for Peyronie's disease to straighten out the penis. It works for penile rehabilitation after radical prostatectomy to prevent some of the loss of length. After a penile prosthesis, it works to increase the length and girth. It works when other therapies don't, and it can complement other therapies when they don't work so well. So it's not always, well, the next step is a penile implant. Sometimes the vacuum device can salvage that. It's relatively inexpensive and reusable, and it's safe. I'd like to thank Owen Mumford for sponsoring this seminar. And now we have times for questions and answers.
All right, excellent. So, all right, we'll go ahead and get started with the Q&A. We're actually full webcam now. I don't know if you want to show the glove suction thing again now that we can all just see your webcam. It should be a clearer picture for everyone. Do you want to do that one more time just so we can all see that section we're talking about?
Glove demonstration.
Yeah.
Okay, so this is the manual device. Here's the battery operated device. I tend to prefer the manual one because you just have a little bit more control. So this shows basically how the glove is being drawn into the tube. And so even if you've had an implant, so the whole concept of after a penile implant, what you're doing, there is tissue around the implant itself that can be stretched. So that part, that sausage, so basically what you have is an inner tube in the sausage. You can stretch the sausage by using the device. And there's published papers on it, and you can actually increase the size, the length by as much of an inch, and you can also increase the girth as well.
Excellent. All right, we'll start off with the first question here. Could this device be used to create a pre-erection prior to using Trimix injections?
You know, I thought about that because sometimes, you know, after prostatectomy, or if you haven't used it in a while, the penis kind of shrinks down to nothing, and it kind of and I've had some patients who have had success in using this, just a few pumps, just to get it long enough to be able to do the injection, and that works in some patients. Then I've had some patients where you've already increased the blood flow, so because you've increased the blood flow, the Trimix washes out faster. So I've had it both ways, but yes, that is a possibility.
All right, next question here. I've tried all pills as well as injections, and they don't work. Will the vacuum device work?
So injections can fail for several reasons. Number one, they can fail because the pipes are just too clogged. And so any amount of increase in blood flow from the injections are not going to work. So that's arterial disease. And yes, you can draw blood into the penis, even though the injections don't work in that setting. Then the other issue is that the pipes are fine, but the drainage doesn't shut down. So it's like the infernal leaking tank in your toilet when the gasket doesn't seat. So you're in the bedroom and you hear the toilet running because the gasket doesn't seat. And the same thing can happen in the penis. Well, then it becomes an issue with, okay, you give yourself an injection, you stand up. Now, when you stand up, what happens is that you have a pressure head of your body that basically prevents some of the venous return. So you end up with a partial erection. In that setting, you can use the vacuum device to increase that, to maximize that erection, and then slip on the constriction device.
All right. Do you need to be aroused to use a VED, or will it work if you're not aroused?
Well, no, you don't have to be aroused, but I presume that the reason why you're using the VED is because you want to have sex. Now, for the penile reconditioning, you don't have to be aroused. So you hop in the shower, and you guys may need to do some manscaping there because sometimes the hairs get in the way. So you're in the shower, hop in the shower, you take your 2 or 3 minute shower, your body's warm, your body's moist, you don't necessarily need a lubricant. And then you put the vacuum device on, and that's when you do your penile Pilates for 2 minutes.
All right. So speaking of the shower, someone had a question. Is it safe to use a VED in the shower?
If you're using the manual device, sure. I wouldn't use the battery operated one.
That's
Not
a good
for
point.
fear of shock, but you might short it out and it won't work.
Yep, absolutely.
I don't think they make a waterproof vacuum device.
They should, though. All right. So I got a follow-up question from someone about something we talked about earlier, using trimix with VEDs. What would be the proper order that you would suggest to use trimix in your VED?
You got to do what works for you, and there's no absolute answer. You can do it before, you can do it after. So this is a little bit of an art, and everybody is ever so, you can combine, for example, you can combine the Cialis or Viagra with injections and the VED. So when a guy comes to implant, I want him to feel that he has tried everything possible, and that includes adding the injections to the PDE5 inhibitor, and also using the vacuum device if that's something that he wants to do. So I encourage experimentation with all three of these to try to get, because not everybody needs an implant. So it all depends on what your needs are. I had a patient today who said that he doesn't need a rigid erection because his wife has so much vaginal pain with penetration that they're happy enough to have a partial erection, and then they have their mutual stimulation.
All right, next question here. I get a usable erection, but it deflates within a minute using the smallest ring. Do you have any suggestions for how I can maintain it?
So it deflates. So that would suggest to me that there is substantial venous leak here. And again, combine it with the injections, combine it with the PDE5 inhibitors. You don't necessarily just rely on the vacuum device. You got to find that sweet spot. Is it an injection of Trimix, and then 2 minutes later, while standing, the vacuum device? You'll find that the penis will fill much better if you're standing and you use the vacuum device.
All right, I got a question here, wanting some clarification on the reconditioning practice treatment. So for reconditioning, they're asking a question here, for reconditioning, you create an erection and let it deflate 10 to 15 times in 2 to 3 minutes, or
Correct.
create an erection that lasts 2 to 3 minutes 15 times.
No, this has to be practical, and you have to say, and that's why I did that study. I said, do you need to have your erection for 15 minutes? Or are you accomplishing something with just repetitive filling, emptying? So just like you would stretch before you go for a run, you don't do a big stretch for 5 minutes. You do multiple stretches. You stretch the tendons, you stretch the muscle. Remember, the penis has been in the state of contraction for 24 hours, because the last time you had an erection was when you used the vacuum device. So you have to kind of coax that muscle into stretching. You can't just like rip it open. So it's like any delicate tissue. You got to coax it into stretching.
All right, next question here. Will supplements like Argonine help my erection issues? Are there other natural supplements you'd recommend?
Arginine is basically an amino acid that with oxygen gets converted into nitric oxide. So you have to consume massive quantities of this arginine to really change the amount of nitric oxide, and that's really what you're trying to do. Now, what Viagra does, or Cialis, or Levitra, is, so now you have your nitric oxide that is a gas, and it combines to convert a GTP to cyclic GMP. Now, cyclic GMP is the power pellet for erection, but you don't have cyclic GMP unless you have nitric oxide. If you don't have L-arginine and oxygen, again, oxygen, right? How important is oxygen in the creation of nitric oxide? It's huge. And the penis, in the flaccid state, is in the state of low oxygen saturation. So the vacuum device is bringing in oxygenated blood for an hour, which is good. So what Viagra does, so you have this, you have cyclic GMP, which is the power pellet for erection. And then if you have a power pellet, remember the Pac-Man game? You have Pac-Man just chewing up the power pellets. So the reason why Viagra works, or Cialis, is because you put something in the mouth of Pac-Man and he can't chew up the power pellets. So it's more effective to block the Pac-Man than it is to basically load yourself up with L-arginine. In order to really make a difference, you have to take levels of L-arginine where the side effects are really intolerable. So L-arginine is available. It's, quote, natural, but it really is not effective.
All right. If an erection is inadequate for penetration while wearing the tension ring, can you pump the device with the ring on?
You could try. Again, there's no absolutes here, but I would probably want to, you can probably use a lower dose of Trimix to get the blood flowing before you use the vacuum device. So what you're doing with the Trimix or the Viagra or Cialis is you're relaxing the muscles before you stretch them. So the concept is that you're increasing the elasticity of the tissue of the penis before you apply the vacuum device. So I don't know that, using the ring, I would play around with the Trimix and the vacuum device before I would go putting on a vacuum device on a penis that already has a constriction. Because you're really you're working against yourself in that setting. Why not increase the blood flow first before you do the vacuum device and then put the tension on?
All right, got a question about Peyronie's disease here. I have Peyronie's and I'm self-treating with the device. I still have a curved banana. Will it ever be normal again? Do you have other recommendations?
Peyronie's disease. That's a tough one because there are, if the curvature is bad enough, it's the device becomes somewhat painful when you try to use the device. So I have all my patients with Peyronie's disease on a PDE5 inhibitor on a daily basis. They use the vacuum device on a daily basis. And if their testosterone is low, they all go on testosterone therapy. All this is to change the micro environment of the penis. Many guys with Peyronie's disease have low testosterone. So everything that I'm doing with the testosterone and the PDE5 inhibitor is to maximize the oxygenation of the penis. The vacuum device is the mechanical treatment. So in a setting where you've maximized your environment, again, the flaccid penis is in a state of hypoxia, low oxygen. So what I'm trying to do is to increase the oxygenation of the penis through pharmacologic ways, at the same time on a daily basis, trying to mold the penis. You saw from the slide how the penis can be stretched with a vacuum device. So you have to be persistent, but you also can't just rely on the vacuum device. You have to change the other factors as well. And as you saw from the slide, I went over it quickly, you can combine the vacuum device with Xiaflex. All my patients who are on Xiaflex use the vacuum device as well. So we have Xiaflex, we have testosterone, we have the PD5 inhibitors, and we have the vacuum device. It's all part of the treatment, medical treatment of Peyronie's disease.
All right, next question here. While using the VED, the base of my penis starts hurting. Why? Am I doing something wrong?
That's a tough one. I don't know. Because from what I'm hearing, if the base is hurting, does that mean that the end of the penis is not getting engorged? So you may have differential swelling of the penis where the base is getting engorged, but the end of it is not, and it could be just leaking out through other veins. So I don't quite know the answer to that question.
All right, we'll move on to the next question then. What are the protocols for using a VED while on blood thinners?
Well, anyone who's on blood thinner, Eliquis or Coumadin, I have patients who I do implants on, and they're still on Eliquis during the implant. So it's just you have to use common sense. You don't want to use you don't want to use too much vacuum. You don't want to use, if you start getting bruising of the penis. I've had some very aggressive patients that have gotten permanent bruising of their penis because they've applied the vacuum device so aggressively. I don't recommend that. So you can get bruising even though you're not on Eliquis if you apply too much vacuum. So use common sense, and you'll find out how much you can get by with. But it's like you don't want to break the capillaries. You don't want to break them, but you can still have an erection without rupturing the capillaries in the skin.
Next question here. Does age matter in order to use a VED? Can you be too old?
Absolutely not. So it works for all ages. And, you know, it's like anything else. Age is just a number. I have put in implants in 94-year-olds who came in with their 92-year-old wives. So, you know, age means nothing. I have 60-year-olds saying, well, I guess it's ready. It's time to throw in the towel. And I'm saying, no, why? So if you're motivated to do it, do it.
All right. Next question here. Are there any long-term side effects from using a VED?
A happier marriage? Not really.
That's a good side effect. All right. Moving on to the next question here. Penis length drastically reduced from surgery, ADT, and radiation, and barely fits into my vacuum device. Any tips for a short tip?
So again, I'm very aggressive about, and the oncologists here know it, about men on ADT and after radiation therapy or radical prostatectomy. And the key is to not give up and not expect huge changes quickly. It's taken a while to do that because on androgen deprivation, you lose all your nocturnal erections. On after radiation therapy, you're frying all the tissue. So there's collateral damage to the penis when you have radiation therapy. Now you add that to the androgen deprivation, and then you go for a period of time where you've done nothing because you're waiting for your PSA to going down. You don't feel like having sex because your testosterone is 0. And then finally, you know, the androgen deprivation is over, and guess what? Oh, now I have a little penis. And what do? Well, it can regain some of its size, but again, you have to do it gradually and methodically and daily. So it's not one of these things where, oh, I'm going to do my vacuum device today and I'm going to have a 7-inch penis. No, you got to do it methodically. You might not want to. You might want to be on the PD5 inhibitors because they're going to increase the blood flow in your penis. You may want to combine it with the injections. So again, there's no absolute formula here. You can use both of those. And when you've been on androgen deprivation and you've licked it and you are now ready to be sexually active again, you have to pay attention to your penis and you have to treat it nicely, and you have to use the vacuum device and the Viagra and maybe the injections.
All right, got an interesting question here. Should I also consider using a vacuum erection device even if injection therapy is working for me?
Okay, so it depends on the scenario. So I have patients that use the vacuum erection device daily for whom injection therapy after a radical prostatectomy. So they're using the vacuum erection device daily because they're using the injections once a week or once every 2 weeks. That's fine. But what's the penis doing the rest of the week? Oh, nothing. So that is your daily exercise, just like you would go out and walk for a mile. You're keeping your muscles in shape, just like you would keep doing your Kegel exercises so you don't leak. The penis needs attention. And just because injections work doesn't mean that you're relying on injections for your penile health. It's common sense.
All right. Good. Next question here, is it safe to use 2 same-size tension rings simultaneously?
Does it work? If it works, then that's fine. If you're using 2 rings, your penis needs that. So what's the option? Nothing. Don't have sex. There's your option. If it works, do it.
Simple enough. I like it. Next question here. What's the difference from the penis pump in the sex shop versus a VED from NMD?
Well, I had a slide on that. So basically, what you do know from the ones that you buy through MenMD or a reputable dealer is that the FDA has approved this instrument. So the FDA says, you're going to make it with these specifications. It's going to be able to do this much vacuum. And then so you go in your sex shop and you say, well, this one's $25.99 or $19.99. And someone basically made this device. There's actually no attention to in terms of the specifications that the FDA has laid out. Does that mean that they don't meet these specifications? No, but you just don't know that. So it's like, if you get medication from, sometimes you get some of the medications that are from generic medications and you don't know the quality control. So it's the quality control that would be the issue. And this is your penis. You gotta treat it right.
Absolutely. All right, so next question here. I don't seem to be getting a proper seal for the VED. I read that I should manscape and that should help getting a proper seal. How important is it to manscape to use a VED?
It's only one way to find out, and that's to manscape. But,
right.
There's a VED or, anyone who does scuba diving. If you have a mustache, you can't get a good seal on your mask. Well, the same thing is true with the VED.
Absolutely. Okay, so we're coming down to the end of the event here. We'll ask a few more questions and then we'll go ahead and wrap it up. So next question here is about blocked ejaculation. I know you talked about this briefly at the end of your presentation, but they say, I have a problem with blocked ejaculation when using the VED. Is there a solution to this?
No, I mean, that's the mechanism of the, you're having an orgasm. And I mean, what's it all about? Is it about ejaculation or is it about having the orgasm? Well, sex without orgasm is no fun. There are men who have had a radical prostatectomy who cannot have an ejaculation, and they're happy to have they and their partners are happy for the dry ejaculation. It's not messy. So a dry orgasm, I'm sorry. On the other hand, patients that are on Flomax saying, oh my God, it's a terrible drug, I have no ejaculation, even though they have an orgasm. So the solution, if that is bothering you, the lack of ejaculation, then maybe the vacuum device isn't right for you.
All right, next question here. During practice sessions, the urge to keep pumping the handle is always present. Can I damage my penis if I over pump?
Well, yeah, I've seen some patients that have been pretty aggressive about their vacuum device because they wanted to increase their penile size to ridiculous levels. And they end up with a kind of, rupture of the small capillaries. And if you do that enough, you can basically discolor your penis and it becomes kind of like tan and looks kind of strange. So yes, you can rupture the capillaries repeatedly by doing too much suction.
All right, and the last question here, is it possible to get to a time when you may not need the VED after some time and you revert to your natural erections?
I'm not sure what the context of this is, if this is after a radical prostatectomy, because there is a return of erectile function that occurs after radical prostatectomy that really peaks at about 18 months. So is it possible that you can use the vacuum device kind of like your penile Pilates and coax your penis into its health and then have natural erections? Sure. But if this is, diabetes for 20 years and the injections don't work and the vacuum device is working, don't expect your erections to come back. You just, some things you can't change.
All right, and with that, I'd like to thank Dr. McCullough for taking the time to present today. We'd also like to thank everyone listening in for attending this MinMD Real Talk webinar. We hope it was informative and you'll join us again in the future. If you'd like to learn more about VEDs, you have a few options. There are more resources in the Resource Center on minmd.com. Visit this page to view instructional videos, guides, expert articles, and much more. If you have a question and would like to speak with someone in person, you can call MinMD at 857-233-5837 or log into the Password Protected Secure MinMD portal to schedule an appointment with a MinMD clinical case manager. If you don't have a specialist for your sexual or urinary tract health, MinMD has a new physician finder service. So go to minmd.com and click Find a Physician in the top right corner to get started with that. And finally, if you're interested in purchasing a VED from us, you can do so on the shop page in the MinMD portal or by calling into our office at 857-233-5837. We'll also be sending a follow-up email with references to helpful resources and links to each after the event. I'd like to thank everyone again for attending today's webinar, and we will see you at the next one.
Thank you.